What's up, y'all? Welcome back to From the Ground Up. I hope you've been enjoying the first few episodes so far. I know I have. I have just eaten up going into my deep dives of all the fun biomechanical things so far. Today, we're going to shift gears a little bit, okay? Today, I want to talk about having a method, a treatment method in your clinic and why it's vital. So I believe that having a method in your clinic is essential to improving patient buy-in, patient retention, patient outcomes, and ultimately patient satisfaction. I'm going to be honest, methods used to give me the ick, okay? I used to see other clinics touting their methods, our 3-step process, our 3 phases, whatever the case was. I would kind of roll my eyes, to be honest, and be like, how do you know that every single one of your patients or clients that you ever see is going to walk through these 3 steps, these 3 phases? Like, how do you know that? Okay, it felt rigid to me. It felt inflexible. A lot of times it would come with a fixed number of sessions. Like they would say, of our 3-phase method, 4 visits encompasses every single phase for a total of 12 visits. And it gives me the ick, y'all, because I'm like, how do you know without ever talking to the human that it's going to take 12 sessions? I don't even know that it's going to take 12 sessions if I'm on session 11. Like, literally. Methods used to give me the ick, to be honest. But then earlier this year, we worked in my practice in Genesis. We worked with a CMO, so a chief marketing officer. We brought her in, getting her opinion on how our brand, how strong our brand was, on our messaging, on our strategy for how we were marketing and things like that. And she pointed out pretty quickly that we didn't have a method listed on our website. When she asked us, what is your method? My answer was kind of like, we help people, and like, we treat everyone as an individual and we're the best at what we do. And so she kind of pushed on me a little bit and was like, Becky, like, we got to have a method here. And I voiced my concerns to her. I explained how some of the other clinics in the, over the years that I've seen list a method, gave me the ick and why. And so she really helped to reframe it and helped me realize ultimately that I was already using a method. Okay. Whenever she kind of asked me, okay, walk me through how you treat patients, high level, big picture. Walk me through what you're looking at kind of early on in their treatment phases. What are you doing kind of as they move into the next phase? And then, she kind of teased out in general what it looks like for me to take a patient through a full plan of care, which was extremely valuable. It was invaluable, truly, because it really helped me realize I was already using a method. And it helped me realize as I looked not just at my own self and my own treatment style and method, as I looked at my team, at Genesis as a whole, and them having learned from me and learning from each other all of these years, they were following my lead as best they could. They were using their own brains, of course, doing their own treatment styles, and they had full autonomy over their patients. Of course they did. But because it's my practice that I've grown from the ground up, I have trained my team in what is now known to me as my clinical methodology. And that was important from the get-go because when it was just little old me starting Genesis, and then as I started to hire people, I wanted patients, whether they saw me or my teammates, to have the same quality, the same level, continuity of care. It was important to me that they had that, but what I didn't realize was I was essentially teaching my team as I hired them and as we continue to learn together and grow together, kind of my methodology, my method of how I was going about treating a patient. And so they were following my lead as best as they could without me literally handing them a piece of paper that said, here's kind of the general method that Genesis takes patients through. Okay. They were doing their best and they were doing a wonderful job. Of course they were. But it was kind of this problem of, you've heard that quote, do you see what I'm saying? Or maybe someone's, explained something to you and then they've finished their explanation with, do you see what I'm saying? You see what I'm saying? No, I don't see what you're saying because literally you're so confusing right now and I have nothing to look at, so I don't see what you're saying. And so it was kind of that same problem that I realized earlier this year was they don't see what I'm saying. They're doing their best and they're amazing clinicians. They wouldn't be on my team if they weren't, and they are helping their patients and they are doing their best to kind of carry on the Genesis methodology, the unofficial Genesis methodology for treatment, right? But they don't see what I'm saying because I had never taken my method out of my head and put it onto paper for them to understand and for them to be able to grasp, let alone for our patients to be able to see what the heck to even expect. So as soon as I realized this, as soon as I realized that I had to get my methodology out of my head and onto paper, as soon as I did that and then we began to implement the Genesis method throughout my team and into the patient experience, we very quickly began to see conversion rates, retention rates, and fill rates all increase. Those things lead to better patient outcomes, which leads to better patient satisfaction. So let's get into kind of this idea of a method. And I want to start with actually what a method should not be. And I want to start here before I make the case for you to define and implement your own method, because this was my experience before I ever designed and implemented my own method. Was I was having the ick of all these other methods that I saw. And so I kind of defined for you guys what that ick was and what was it that was making me not want a method in the first place, right? So really what it was, looking back, was these methods that seemed rigid, and they seem to take away the ability for, me and my team to use our own clinical judgment with our various patients. So a method should not be that. It should not be something that's rigid. It should not be something that takes away your ability to think or your team's ability to think. I would never want you to say, this is our method, and then the method includes you telling your team exactly what to do, how to treat your patients, how to progress your patients, when to progress their patients, like all the things. It should not be that. A method should also not be a set number of phases or sessions per phase, okay? Our method, which I'm going to explain to you guys here in a little bit, is 3 phases. I think 3 is kind of an easy number because it's easy to conceptualize. A 2 is just, two is too small, okay? 1 and 2 is not a method. Those are just random steps within a method that you haven't completed yet. So you have to have more than 2. 3 is going to be your minimum. And really anything more, I'm just going to go out there and say 5. 5 is a lot, y'all. Like, imagine trying to remember yourself 5 steps to your entire treatment methodology, let alone ask your team to remember it, let alone expect your patients to remember where they are on their journey. 5 is a lot. So I think sweet spot's going to be 3 or 4. That's my opinion. That's what works for me. And that's kind of what I've learned as I've looked at these other methods and kind of designed my own. The point is a method is not a set number of phases, and it's certainly not a set number of sessions. I remember vividly seeing a clinic that had our method includes 12 treatment sessions, 4 sessions per the 3 phases, right? I'm like doing the math in my head. I'm like, is that right? Yes, 3 times 4 is 12, Becky. It should not be that rigid to where it's X amount of sessions and X amount of sessions per phase, okay? A method also should not be a treatment plan that leads to cookie cutter treatment approaches, and frankly, that dehumanizes the patient that is in front of you in your clinic, right? That's what a cookie cutter plan does. Everyone gets this. All my patients do this in this order, right? What this could look like, a method that gives me the ick, right, is at our clinic, everyone starts on a hot pack, then they ride the bike. Then they get manual therapy, then they get exercises, and then they come for 3 times a week for 8 weeks. That is horrible. And that's the type of thinking that made me from the get-go have the ick when it comes to thinking about a method, and why I used to say I'm never going to have a method because I'm not going to confine me and my team to how we treat and not let them use their brains. And so I've since learned that that's not what a good method is, okay? But I wanted to touch on some of those things of what a method should not be, because those are some of the main things that used to give me the ick before I kind of designed and implemented our own method. Let's move into, if that's what a method should not be, let's talk about some things that a method should be, okay? The point of having a method, the whole point, is to show the patient where they are now and then cast a vision of the journey ahead. I always describe this kind of, on like maps. You're at the theme park or at Six Flags and you look at the map and you have the big red circle that says you are here. This is what the method is doing. We are able to print off our simple method and we are able to show it to our patients and we are able to say, you are here, right? You're at phase 1, step 1, whatever we call it. And they're able to visually see, okay, she's pointing here. If I'm here, then I see that there's 2 more steps after this one, and I can kind of visually conceptualize this journey that lies ahead. They get to start to see where they are and where they're going, and that's really, really important for their buy-in from the get-go, okay? So it's the whole point of having the method is to show the patient where they are now and then cast the vision of the journey ahead. A method should also be, it should be simple, clear, and concise. I cannot stress this enough. We are not writing a 12-page document about our methodology and why we believe what we believe and exactly what each phase has and in our treatment techniques and all the manual therapies that we're trained in. And here's a list of our exercise bank. Like, absolutely not. It should be extremely simple. It should fit on one page and it should be more visual than like copy heavy. Okay. Like, our method at Genesis is you can just look at it and you can immediately tell that there's 3 phases and you can immediately and quickly read the name of each phase and understand what that means. And then if you want to read more, there's like a half a sentence under each phase that tells you a very high overview of what that phase is. So it should be simple, it should be clear, and it should be concise, because the whole point of the method is just to say you are here and to give them a visual of the journey ahead. Okay, that's the whole point. A method should be the how that strengthens your why. Let me talk about this a little bit more, because this whole concept has quite literally changed my life. This why versus how versus what concept, okay? So take the example of my why, my purpose, why Genesis exists, why I do what I do, why I have built a whole course, why I have a podcast, why I coach clinicians, why I coach business owners, literally why I exist in this vocational space, okay? We won't get into theology because I think there's other reasons why I exist, okay? But when we're talking about work and my impact on the world, okay? Why I exist, my purpose is to change the game of pelvic floor therapy. That includes treatment of it. That includes pelvic floor therapy clinics, how they're run. I want to change the game there. That includes how we think about the pelvis and the pelvic floor. All of the aspects that involve the thing that is pelvic floor therapy, whether it's patients, clinicians, teams, business operations. I exist to change the game of pelvic floor therapy. That is literally why I am on this earth. That is why I do what I do. That's my why. How I do that, how I change the game, as an example, one way is through the Genesis method. Okay, and again, I'm going to share our method with you in a second, but that's one how to my why of changing the game. Oh, Becky, how do you change the game? Well, let me share our method, how we do that, how we are treating patients differently and better. Okay, that's a how. I also want to point out the Genesis method is not what I do. It's how I do it, but it's not why, and it's not what I do. What I do is pelvic floor therapy, exercise, manual therapy, education, pay my team well, like the operations of my practice. So there's a very important difference between your why, your how, and your what. And that is not the point of this podcast, but it is important for this particular point. And I will make another episode because I am so passionate about why, how, and what, and differentiating the 3 and how they complement each other. But for when we're looking at methods, the method particularly that you are going to create and implement is how. That is part of your how you do what you do, but it's not why. It's not your purpose, okay? So that's an important distinction. Let me explain our Genesis method to you, just so you have like a working example in your head before we move on. So like I told you before, our Genesis method has 3 phases. Phase 1, root cause. Phase 2, restore. Phase 3, build resilience. Okay? Root cause, restore, build resilience. And so you can see those 3 in the 3 blocks that are on our graphic that we show to every one of our patients that's on our website, all the things. You can see those and have a quick snapshot of, oh, they find the root cause of my problems. That makes sense. And then we go in and we restore the problem and we kind of start to fix what is going on. We restore the function, right? And then once function is restored and I'm moving better, I'm feeling better, blah, 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 whatever it is, then they're going to take me beyond. They're going to help me build resilience so I can experience lasting change for a lifetime, not just for a few months and then end up back in the clinic. That is our entire 3-phase method. We find the root cause. Step 1, always. We always start there. Before we do anything else, we are finding the root cause or causes. Sometimes they're multiple, right? From there, we begin to restore the system. We begin to restore how the brain utilizes the pelvic floor muscles, how the brain utilizes the core, how, functional movement patterns. How can we restore some of those? Nervous system. How can we help the patient restore the nervous system? Everything that we do in phase 2, in the restoration phase, depends on what was discovered in phase 1 root cause. Phase 1 root cause determination is going to lead us into what we do in phase 2 and how we move forward with restoring whatever we found to be the main driver of the pelvic floor dysfunction, okay? Phase 2, I always describe, is like what people picture when they picture rehab. This is the bulk of the rehab phase. This is manual therapies and exercises and lifestyle changes and education and all those lovely things. So phase 2 for us at Genesis tends to be the longest of the phases, Then most of our patients are 80% plus, 80 to 100% symptom-free by the quote end of phase 2. Somewhere along the way, when they're pretty much better or, symptom-free, they're feeling really good. This is when a lot of people tend to drop off, right? Because they're like, oh my gosh, I'm doing so much better. Like, it's been 3 weeks and I haven't peed my pants, or I've been having pain-free intimacy for, a month now. I've reached my goals. So at Genesis, we actually have a phase that goes beyond that, beyond this just symptom resolution, where we are building resilience for them for a lifetime. And yes, that includes strength training resilience, but it also includes tools that we are giving them and, ways to recognize dysfunction early on before it happens down the line. Like, there's so many things that go into our resilience phase that ensures that they are going to stay better, keep those results that were achieved in phase 2, in restoration phase, for a lifetime. Okay, and that's one of the differentiators of Genesis, actually, is that we care about and prioritize that resilience phase, whereas most clinics and honestly most patients tend to drop off at the end of restore phase, right? Because they're feeling better. Their pain is pretty much gone, or it's like 90% better, and they're rarely leaking, and all the, oh, this is great, I'm done. But because we have a method and because we've been showing our patients throughout their journey, you are here, and they have that visual of where else they have to go, they're going to get to the end of phase 2, restore with us. And even though they're 90, 95, 100% symptom free, they have already understood for the weeks and months before that there is more to come. And we've already been kind of caking it in throughout their treatment plan. And as we've been meeting with them and things, what that's going to entail. And we've been painting the picture of what it's going to look like for their particular case and goals and outcomes, what that phase 3 is going to look like. And they're already mentally bought in. So there's no question. Of course, they're going to keep coming after they're pretty much symptom-free or totally symptom-free, right? And so that's our Genesis method. Root cause, restoration, build resilience. 3 phases. It's simple, clear, and concise. Using this, implementing this into our practice has, I'm not even kidding you, very much skyrocketed conversion rates, retention rates, fill rates, patient satisfaction, and outcomes. The data is there. I want to go into how a good method will improve their buy-in, improve their retention, improve their outcomes, okay? One of the ways is that having a clear, concise, and simple method to show our patients from the get-go, it's on the website, it's in, when they inquire, they're getting in their email, whatever it is, they will have an immediate enhancement of trust in you and your clinic from the get-go. Immediately, they are thinking, oh my gosh, they have a whole method. They know exactly what to do. They know how to help me. Like, this makes sense. Because again, they're not getting the ick, because it's not like every patient needs 12 visits. To them, they can see in the Genesis method that, like, there's room for nuance. And, I want them to find the root cause. And yes, I want to restore that. And yes, I would love to feel resilient, right? So they're already, from the very first step they take to reach out to us and hear from the company and my team, is they already have an enhancement in the trust that we can help them. A method also prevents patients from always wondering what's happening, where am I throughout their treatment process, okay? They always will know where they are in their journey, because they always, you're regularly referring back to the method and you're saying, oh my gosh, you are here. We've moved into phase 2. Here you are. And again, they're always getting that visual representation via your piece of paper, or maybe it's on your computer, it doesn't matter, consistently showing them, hey, look, you're here now. And they're consistently getting this visual representation of where they are in their patient journey, so that prevents them from just always wondering. Because of the fact that trust was stronger from the get-go, because they immediately see that you know your shit, right? Like, you have a method and you are doing the things, and this is how you help people. This is your how, right? Because that trust was stronger from the get-go. And then by removing them always wondering where they are, where they stand, what to expect, what's going to happen next throughout the process, those two things together mean that they are much more likely, immensely more likely, to stay under your care and get what the heck they came for, right? That's the biggest part of all of this, is having a clear method that you use with your patients and that your team uses with your patients is going to improve the likelihood that they get what they came for. And isn't that why we all run businesses? So that way we can help people. People are coming to us for help, right? We want to help them. A method is going to immensely increase your chances of helping your patient get the outcomes they came for. And honestly, I would even argue get more than what they came for. You are going to notice, as you utilize and implement this method with your patients, as you have your team implement it, you're going to notice that it's much easier to book out multiple appointments rather than just, oh, we'll just book one at a time or come in as needed or whatever. Again, this is not because we have a set number of sessions or a set frequency or whatever. It's simply because they are already bought in and they're like, yeah, I trust you. Yeah, tell me when and where to be here. I'll be here. In their head, it makes sense. They can see it. And at Genesis, at least, we tend to book out the next 3 appointments for the most part, because anything beyond that, usually we want to be reassessing the need for frequency, because it might change, right? We might discover that we need to come more frequently, or we might discover that we can spread out appointments, or whatever the case may be. So we really tend to book out about 3 and always have about 3 appointments booked out with our patients at any given time. But it's much easier to do that because they're bought in and they trust you, because you've showed them their method and you're integrating your method. You're also going to notice that patients, it's giving them a stronger reason to keep and come to their appointments rather than canceling or being chronic reschedulers. We've all experienced those patients that they're always rescheduling. Oh, I forgot I had this come up, or oh, this came up, or I just forgot I even booked this appointment. And literally those are symptoms of a patient that doesn't understand. And I don't want to put the blame on the patient, right? They have not been given the opportunity to understand the value and benefit of maintaining their plan of care. And your method is one way how you can help them do that. So patients are with this method going to have a much stronger reason to keep their appointments rather than cancel them altogether and never come back, or chronic reschedulers. You're also going to see, because of this increased trust from the get-go and this decrease in them always wondering, where am I in my journey? What's going to happen next? Because of both of those things, you're going to see a natural improvement in patient retention rates and compliance with what you tell them to do. And yes, that means compliance of come to your sessions on this recommended frequency. And that also means do what I tell you to do. Do your exercises. Do these things that I'm telling you to implement into your habits. Try these dietary things, or whatever it is that you're telling them to do. They are so much more likely to comply and to believe in what you're telling them, because they have already been more bought in from the get-go. They already trust you more, and they have less of that, what's happening, what's going on, what's happening next, right? They're just in. They're just like, yes, sign me up, tell me what to do, and I'll do it. Simply because you've shared this method with them from the get-go. Because they are coming for their appointments, right? Because they are compliant with their plan of care, because they are trusting this process from the get-go, our patients are more likely to reach their goals and experience these life-changing outcomes that we all want to provide. That is why this method can be so helpful. Because this is how you get them there, y'all. This is how you move them from simply inquiring and checking out your services. This is your how. This is your secret sauce, how you are going to get them from that inquiry to literally changing their life. All right. This is a huge way that you are going to be doing that. I cannot stress enough. It is so important to help a patient trust you and to help them visualize where I am on my journey and what's happening next. Those two things alone are going to fix so many cancellation and reschedule problems, okay? And compliance problems. It's just a fact. It's just a fact. That's kind of more the patient side of things. Let's talk about the team side of things. A method gives your team shared brand language and a framework to work off of. If you're a clinic owner with a team, it is crucial that you have brand continuity across that team, across the language that's being used when we talk to patients, what's said on the website, what's said, via the admin when a patient reaches out, what's said in the email sequences that we build, and what is said in the treatment rooms of our various clinicians. The brand language needs to have a continuity that whether a patient sees me or they go see Dr. Corey or whoever they see, they are hearing very similar language that at Genesis, we find the root cause. Then we restore those things. Then we build resilience. Okay. They're hearing that no matter whether they see on the website, they talk to my admin on the phone, they see me, they see Corey, whoever they see, it doesn't matter. They're hearing the same brand language, and it gives your clinicians kind of that ammo to be able, it kind of gives them what they need to say. And your team, they want to know how to be successful. They want to know what it looks like to help move your mission forward and what it looks like to be a great team member. And they want to know what they can do to succeed. And this is one way you can be like, hey, just use our method, right? Do this thing. Implement kind of this general language around our method. It's just so crucial that you have this brand continuity across your team. Your patients want to come to your practice, not necessarily to individual therapists. So patients want to come to Genesis because of how strong our brand is, not necessarily any particular individual therapist at Genesis. Now, I want to pause here. There is nuance here because I'm not saying it's bad if a prospective patient finds one of your clinicians on Instagram or they run a workshop and then they want to come see that particular therapist at your practice. That's lovely. That's wonderful. That is a less frequent, that's a one-off kind of deal, right? For the most part, our patients are finding our practice, they're resonating with our brand language and messaging, and they are wanting that. They are wanting that secret sauce that drew them in the first place. And a method allows that commonality among brand language team-wide. It's another way that you can just give as a tool to your team to be able to give the patient what they want. They want to trust us, right? They want to know where they are in their plan. And this is a tool that your team, admins and clinicians alike, can use to create that sense of safety to our patients simply by having brand continuity. Admins will have a way to share the journey with prospective patients that will immediately build that trust and improve conversion rates, because immediately the patient's like, holy crap, this admin is telling me they know exactly how to help me. Yes, please. I want to go to a place that knows how to help me. They are going to feel more at ease from the get-go, which means those patients on the fence, those ones that are like, ooh, I don't know, let me shop around. They internally kind of want to come to you, kind of don't know if it's the right fit, right? These people who are on the fence are going to be much more likely to book with your company instead of back out or, shop around or whatever, simply because of that immediate trust building aspect that having a method brings, and that your admins are going to be able to give to them and invite them into this journey with you guys. Clinicians will have a general framework to use to guide their patients as they progress them through a plan of care, right? It's this, you are here. They have a tool now to show you are here. And this is so helpful for some of my newer team members. My most recent new hire has expressed that she loves the method because it gives her something to talk about, right? She's like, oh my gosh, I'm a new grad. This is all so hard and scary. Valid. True, it freaking is. And this is one way I can help her succeed, because I can help her with this brand language, this framework to be able to show her patient and say, you are here. We're finding the root cause. We're still trying to unpack this. Maybe it's a couple visits in. Hey girl, we're still uncovering a lot of this stuff. And yes, there is some overlap. We are doing treatment as well, but ultimately there's a good chance that for the first few sessions, we are still trying to figure out what the heck is going on. And anyone who tells you that they can figure it out on day one is lying, because pelvic health patients are so complex. And unless you are asking tons of the right questions, which by the way, I love that topic. That's a whole other topic. There's just no chance that you're going to even figure it all out in the first few visits. So chances are at Genesis, we are in this root cause phase for at least the first few visits. And it gives my clinicians this language to be able to say, hey, girl, you are here. We're moving here. We're starting to rebuild things. We're starting to restore the system, but I'm still figuring out some of the why. I'm still figuring out why your nervous system is so upregulated, why that right obturator is so tight and tense, right? So it just gives them this tool to be able to build that trust with their patients, which, by the way, improves their patient retention rates, thus the clinician's performance. I don't know about you guys, but at Genesis, we put a heavy emphasis on retention rates, okay? We want to see our clinicians retaining their patients. We want to see their patients coming back for longer bouts of time, not just 3 sessions and dropping off, not chronically rescheduling, all those things. We reward performance at Genesis based on, one of the things is based on retention rates. That's one of the more objective measures that we reward. Giving my clinicians a method to follow improves their retention rates. So of course they want to do it because of course they're going to want to be better at performing, right? And be rewarded for that and all the things. So it improves retention rates. I want to emphasize though, this only works if your method is highlighting the how to your why, not the what. So I'm going to say it again. This only works if your method is highlighting the how to your why, how Genesis changes the game. This is one way, not what we do. So you'll notice in our method, I'm not saying in phase 1, I do the internal exam. I assess your functional movement pattern. Like, we're not talking about the what we do in the method. We are talking about the how, bigger picture how we are doing our why, how we are living out our purpose, okay? Don't tell your therapist what to do. Again, there could be nuance there. I'm not going to go into it. But for the most part, don't tell your therapist what to do. Instead, give them a framework for why you do what you do and how to do it. That's what this method should be. It should give them a framework for how they do what we do for living on purpose, okay? Genesis method. Root cause, restore, build resilience. That is how we change the game. That is the framework I give my clinicians to show their patients so they have common language, commonality across the brand to show patients how we are going to help them, how we are going to get them the outcomes they freaking came for, okay? It's not what we do. Therapists can pick what they do. They can choose what they want to look at to find the root cause. It can be a million different things, right? I trust my team to do that. I trust them to know what to do, and I trust them to get help if they need it, right? That's part of trust. The method should be the how, not the what. It should be the how and be a framework for that. So, as a reminder, what I want you to take away today and put into action from this episode today, because you can listen to all this, you can be nodding your head yes, you can be clapping, praising hallelujah, whatever you want to do. But if you don't actually take action, it will not matter. Nothing will change. So what I want you to take away and what I want you to put into action today is that having a method in your clinic is essential to improving patient buy-in from the get-go, improving retention of your patients, improving the outcomes that those patients experience, and ultimately improving patient satisfaction across their entire journey with you and in their lives, right? A method is essential to this. Remember, a method is not a rigid process. It is dang well not a treatment plan. It's not a set number or frequency of visits. It's not what you do. A method is your how put on paper. It's how you do what you do in order to live out your why. Hope this was so helpful. I hope you guys feel inspired to go brain dump your method and implement it with your team and give your team this awesome tool to succeed and to change more lives of patients. It surely has done that for us at Genesis. And so if you found it helpful, I would love for you to share this episode with someone that you think it would benefit. And also, I always love it when you guys screenshot, tag me in your stories. Literally, that always makes my day. And I would love nothing more than for you guys to do that. Hope y'all have a great rest of your day, and I cannot wait to catch you on the next one.